Firstly, I'll go through the cases and the numbers of the day. Jerome will go through a more detailed breakdown of that outbreak map, and the Chief Health Officer will talk about his advice and where we find ourselves. First of all, there are 120 cases today. All of them are locally acquired. Sadly, the department is notified of 2 deaths due to the coronavirus. Yesterday, one woman in her 40s and one woman in her 60s, and all of us send our best wishes, our condolences and our deepest sympathies to the families of these 2 women. 64 of today's cases are linked to known outbreaks. 56 are under investigation by our public health team. That takes us to a total of 900 active cases, 895 locally acquired and 5 overseas. Every day, of course, that public health team makes linkages, solves some of the mysteries of this virus, and we'll update the figures as we go forward. There are some 122 cases, though, that remain open, if you like. They're still being investigated. Just to give you a sense of how things have changed and changed very rapidly, of today's cases that have been fully interviewed, and our contact tracers work as hard as they possibly can and as fast as they can, of those that have been fully interviewed, only 20 were in isolation during their infectious period. These last few days have seen a dramatic shift in the nature and the number of cases coming forward. I'll come to what that means in just a moment. In terms of vaccines, there were 33,455 vaccinations administered yesterday in our clinics, and we're very pleased to see that. That's nearly going close to 2.5 million doses being administered through our state-run centres, and more than 5 million doses delivered across Victoria by all of those who are involved in this massive task. We are now, that is through state hubs, we're now more than halfway through our target of 1 million vaccinations over 5 weeks. We've now reached 522,051 doses that have been administered. In other words, we will reach, and I think we will exceed, our target of 1 million over the 5-week period. And I want to thank everybody who's made a booking. I want to thank everybody who's turned up and honoured that booking. And of course, I want to thank all of the staff who are making our vaccination efforts in state clinics, which are among the strongest and best anywhere in the country, possible. There were 56,051 tests processed by our laboratories and results received overnight. Again, thanks to those teams, and thanks so much to those 56,000 people who came forward yesterday and got tested because they had registered symptoms. I cannot say it often enough. If you've got symptoms, you've got to get tested, and you've got to get tested really quickly. If you would be out of pocket, if you wouldn't be able to do a shift at work because you are waiting for your result, then there is a $450 payment available to you. If your results are positive and you have to isolate for 14 days, there is a $1,500 payment available to you. We know that not everybody can fall back on leave. Not everybody have got those sort of resources. Therefore, we have these plans and these payments, and we've made many thousands of those over these last 20 months. They're there for a reason. They're there to be paid out. They're there to support those who otherwise perhaps wouldn't be able to do the right thing by all of us. So we just again remind people that those payments and that system is available. There are 58 people in hospital, 21 are in ICU, and 14 of those 21 are on a ventilator. Of course, we wish them all the best, and we thank our staff who are doing an amazing job in caring for those patients and indeed all patients.